I will turn it over now to my colleague, Janine Kuzma, for some brief introductory remarks. Over to you, Janine.
Good morning and welcome, everyone. For those of you I haven't met yet, my name is Jacqueline Kuzma, and I am the Senior Manager of Gift Planning here at St. Joseph Health Center Foundation. It's truly a pleasure to welcome all of you today. A special welcome to our St. Joe's Society members joining us in person. You are visionaries who have chosen to include St. Joe's in your estate plans. Your generosity is helping building a healthier future for our entire community. And of course, a warm welcome to all of our supporters, donors, and friends joining us online. Thank you for your dedication to the health and well-being of those we serve. Today's topic is keeping active, and we are lucky to have with us our very own Jacqueline Holloway, whom I will introduce in just a few moments. Before we dive in, I want to take a moment to thank the Slate Family Foundation for their generous support. Their ongoing commitment to seniors' health is what makes this series possible. I also want to respectfully acknowledge the land on which St. Joe's operates. This is the traditional territory of many First Peoples, including the Mississauga of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and Wendat peoples. Today, this land remains home to many diverse First Nations, Inuit, and Métis peoples. And Toronto is covered by the Treaty 13 of the Mississaugas of the Credit. Now, before we get to our presentation, I have an exciting update to share with you. As many of you know, our West End community is growing fast. We are now serving nearly 500,000 people, and the need for extended specialized care is growing just as quickly. So I'm thrilled to let you know that we are just completed the largest fundraising project in St. Joe's history, the full expansion and renovation of our emergency department. This state-of-the-art space features 40% more capacity, advanced technology, and specially designed zones to better serve our patients in the moment of crisis. What makes this milestone even more incredible is the fact that the project was 100% donor funded. It means it is thanks to you, your trust, your generosity, and your shared belief in an extraordinary St. Joe's. And we are not stopping there. Our growing community means there is still so much more to do. Looking ahead, we have exciting plans to expand key areas like our ambulatory care services, surgical suites, and mental health programs. If you'd like to learn more or make a gift or include St. Joe's in your estate plans, please don't hesitate to contact us. My contact information will be on the screen at the end of today's presentation. Now, without further delay, I am delighted to introduce to you our guest speaker, Jacqueline Holloway. Jacqueline is a physiotherapist with over 25 years of experience helping patients with neurological, cardiovascular, and musculoskeletal conditions. She works with older adults at St. Joe's Clinic for Healthy Aging and Heart Failure, creating personalized rehab programs that help people to be mobile, independent, and thriving. At the end of her presentation, Jacqueline will answer questions, first from our audience that are joining us online, and then from our guests in the room. Please join our guest speaker, Jacqueline.
Difficulties again with the internet. Thank you. Thank you.
Thank you so much. Welcome to everyone who is attending today. It's my pleasure to speak to you all and share some information to help with getting active and also making time for exercise. So today's topics, thinking about as we age, why does it seem a little harder to do the things that we used to do? Why is it important to reduce sedentary time? And we'll discuss what are the important types of exercise that I'd recommend. And also thinking about how to prepare for circumstances where you might feel unsteady, a little off balance, so that you might be able to recover more easily. And also we'll take a look at getting up and down from the floor, some of the physical skills and planning that you can prepare for an occurrence of falling if necessary. Okay, I'd like to begin with something that's hot off the press from the Canadian Society for Exercise Physiology. It's an article from the Canadian Medical Association Journal, and it specifically outlines a differentiation between physical activity and exercise. So in their definition, physical activity is movements through skeletal muscle contraction, requiring energy, increasing your heart rate, and increasing your breathing. So I recommend being active, doing your everyday activities, enjoying these activities that you are interested in, and also adding in a little bit of time for exercise. So the definition of exercise is a subset of physical activities that are planned, repetitive, structured, and purposeful movements. So aimed at improving and maintaining a component or multiple components of physical fitness. So looking at those two separate definitions, we'll go into some topics today for discussion, and think of any questions that you might have that I can address at the end. Okay, first, starting off looking at how do we move, how do we do our daily activities, what are the systems involved in the control and in powering our movement, the structural support of our bodies. First of all, looking at the bones, the muscles, the joints. With aging, there can be slight decreases in strength, changes in flexibility, changes in power. So this is one of the systems we have to address with exercise. The nervous system control the brain, your nerves, the reflexes. These are physiological processes that may change with age as well. So thinking about your response time, reflexes, agility, adjusting to distractions in your environment, thinking about coordinating activities when you're carrying something and going upstairs, thinking about your sense of movement, where your limbs are in space when you're walking, stepping. Sometimes as we age, multi-step exercise activities or other activities might require a little more effort and focus, but these are all things that we can address with physiotherapy, exercise, and activity. So exercise programs that are structured, that are individualized with a little bit higher intensity and longer duration, they show promise for preservation of cognitive performance. So this control system of the body benefits from exercise, as well as the structure, and as well as the cardiovascular system. So when we're active, heart and lungs, they need to adjust to the increased demand for energy, increased demand for oxygen. So as we age, this might be a little less efficient over time because of all the interactions of these complex systems, but exercise training can help with all of these things. When you think about exercise and safety and well-being, in addition to just general aging changes, there are some considerations that you might want to look at if you have other medical conditions. Always check with your doctor or a healthcare professional if you have something that can also affect your ability to exercise in terms of possible conditions that are listed: heart or lung disease, arthritis, osteoporosis, injuries to the spine, diabetes, kidney disease, neurologic conditions. So these are factors that might necessitate speaking with your doctor, healthcare professional, just to give you some guidance, because it is recommended activity and exercise is part of your treatment, your care for some of these conditions as well. So we have some thoughts, areas of concern where we need to address, so we can sort of get ahead of the aging process, so we can keep the body active, keep the mind active, reducing sedentary time. So these are some main components that you should think about most days. Setting aside time for exercise, and this exercise should be a slight challenge, something a little more difficult than your usual everyday activities. And that is the key to increasing your strength, flexibility, and ability to do everything daily. Oops, the screen is not participating properly. Apologies. Okay, thank you. What can we do about this? We have our screen that we can see better now. So let's go ahead. Okay. All right. Recommendations for exercise to optimize your function. The number 150 minutes of moderate intensity physical activity per week is a general minimum amount of exercise. So that equates to about 30 minutes, 5 days a week. So think about investing in that time to do exercise that's challenging and contains these components, a mixture of different activities that can address the different needs of the body for strength and activity. So we have just general movement, stretches, moving through a range of motion that will allow you to do the things you'd like to do every day. Reaching up into a cabinet, reaching to put on your shoes, things, working at woodworking, working in your garden, any sort of activities you like to do, keeping your body moving through that range of motion is important. The second component is strength training. So resistance training, weights, exercise, where you're moving against resistance. So hand weights, you might think of ankle weights, resistance bands, moving against the gravity on your own body. Okay, aerobic exercise is our next. Aerobic exercise is the third component to consider when we are doing our exercise program. Aerobic exercise is defined as involving large muscle groups that results in a substantial increase in heart rate and energy expenditure. So this is a very important component for our cardiovascular health. Then our fourth component you need to think about is your balance training. It combines almost all the other types of exercise together in a functional way to help you prepare for being off balance, prepare for everyday activities that might be challenging. Even when they're not challenging, you never know what sort of surprises might be around the corner. So being prepared, training yourself to do things a little bit more difficult than you might normally do each day will make the usual activities much easier. So back to the descriptor moderate intensity. So it might feel comfortable, a little bit sweaty, a little bit tired, but that tells us we've challenged our muscles. You want to look for that challenge to really make a difference in your strength and abilities. Okay, some particulars about each of those types of exercise. So you can think about how you might involve these types of exercises in your daily activities and things that might be helpful, particularly to you and the things you like to do. So as I mentioned, moving through a normal functional range is important to keep your ability to do the things you like to do. Stretching, moving through full range, it also maintains the joint mobility as well as the muscle, tissue, tendons, keeping everything in alignment. So thinking about alignment, your posture is very important when you're going to exercise and walk. As everyone's sitting up nice and tall, I'm trying to recall my own posture. It's very important to have that alignment of your ears, over your shoulders, over your hips, over your ankles. So when you're walking, even when you're sitting, the shoulders over the hips, this posture is a really good starting point for where you can take a deep breath, get oxygen for the heart to supply to the muscles and function well. So posture is key. Okay, now we're moving on to strength exercise. So you're building muscle. This muscle will support your joints. It'll help maintain your bone density for stronger bones. Strengthening occurs when you move against resistance. So you're pushing or pulling, activating those muscles, and the progression of tougher exercise, a heavier weight, is necessary gradually and carefully to keep these strength gains and make sure you have the strength to do your everyday activities. So as I mentioned before, different type of weights you can use, but you can use everyday objects as well, water bottles, books, cans, filling a sock with beans, things like that. You can be very creative, so you don't have to go out and spend money on specific equipment. There's lots of things at home that you can use for strengthening. But that's strength, muscle, increasing the bone density, addressing the bone remodeling. Every time your muscle pulls against the surface of the bone where it is attached, that stimulates the bone to absorb and strengthen. So the structure inside the bone is stronger. That's why resistance exercises and weight-bearing exercises are highly recommended. Okay, aerobic exercise, cardiovascular endurance. So thinking about activity tolerance, exercises like walking, cycling, you can walk on a treadmill, swimming, sports, so team sports or individual sports, all these type of planned activities for your aerobic exercise is wonderful to increase your tolerance. So this can assist if you have shortness of breath from medical conditions. It can reduce your fatigue, and basically the physiological benefit is improved efficiency of the oxygen being delivered to the muscles. That's aerobic exercise, and it can be very important to the bigger picture of health and daily activity. A part of aerobic exercise, I like to incorporate breathing exercises. So it's partially a strength exercise for your breathing muscles, but this ends up happening, the strengthening of these inspiratory muscles when you are active regularly with aerobic exercise. Okay, the fourth component of an exercise program that's thorough and can help really with the aging with insight, aging well, is balance, coordination, and agility type exercises. So balance exercises are what give our muscles practice, practice to recover from a difficult situation where your balance is challenged. Also practicing coordination of activities, exercise that helps your brain practice processing the steps of motor control, being able to process your busy environment, and just being prepared for possible unknown obstacles, being ready, agility, so you can move to adjust to any sort of disturbances in your daily activities. Okay, so those four components, that's one of the main things I'd like you to remember. Now, moving on to general exercise tips. And in my physiotherapy practice, working with people, I always mention back to the posture. It helps preventing injury to your shoulders if you're doing arm exercises, balance exercises. Your back stabilizes your whole body. Your abdominal muscles stabilize your back and can prevent injury to your back. So thinking, even just when you're sitting in your chair, thinking about tightening your tummy muscles, holding a muscle contraction for 5 to 10 seconds, but keep doing your breathing as you tighten those muscles. So right now, everyone could be doing a little bit of a workout with your abdominal muscles. When you're walking daily, you can tighten your tummy muscles a little bit too, just to have that stability in your back. Deep breathing is something I like to incorporate in most exercise programs as well. As you control the movement when you're lifting weights, as you're stretching, you're going to inhale slowly, expand your lungs fully, and also exhale slowly. Nice controlled breath, and that'll be mirrored in your exercises, controlled movement, safe without causing any potential overuse or injury. So that moderate intensity exercise. Many people ask, how do I know if I'm getting to that level of exertion where I'm going to be benefiting from my exercise program? Thinking about a scale of 0 to 10, you want to be around a 6, where 0 is completely resting, 10 is the most strenuous exertion. So you want to avoid these extremes, and for your exercise, stay at around a level 6. You will feel a little tired after you do a bout of exercise. A planned session of exercise should create a little bit of fatigue. You might feel like you're breathing a little more heavily, but you're still should be able to pass what we call the talk test. So if you're walking with your friend briskly, you should be able to speak to your friend. You shouldn't feel so short of breath that you can't speak, you can't talk. So keep that in mind when you're monitoring your own exercises. So as I mentioned, you might feel a little bit of sweat, but that is expected, that is normal, and it's a part of working those muscles, working your body with a challenge. There could be some little aches in the muscles, some aches in your joints. I know this isn't sounding so great, but a little bit that lasts only a very short period of time, that is your feedback telling you, yes, I've done exercise that will really benefit me. So I just have an example of it. It's a good idea to think through maybe different activities that you practice in the day, things you might get up to, and how you would assign a level of exertion to them. So for example, I just came up with some ideas. When you're completely resting, that might be 0. When you sit up with tall posture, you are activating your muscles, thinking about controlling your movement. Standing still. When you're standing, you're activating all your leg muscles, your core muscles. And so gradually through this list, a progression of maybe difficulty that will give you a higher level of exertion. So I don't recommend going running on the treadmill or really intensely exercising unless you're an athlete or if you have a history of being in sports and athletics and working your way up through a level of exertion. Like this is a way to progress things slowly. You always want to gradually increase your exertion and not jump from full speed to sitting and resting. So your exercise needs to include a little bit of a warm up. So you might walk slowly to warm your body up, your muscles, your joints, so that they're ready to do their exercises for strengthening, balance. And then at the end of your exercise period, also take another 2 to 5 minutes to cool down. You don't want your heart rate to go from its optimal sort of high intensity to all of a sudden sitting down. So you gradually, it's like a rolling hill of exertion. That's another component to think about. Okay, fall prevention. This is another topic that's quite common on people's minds, and for yourself, for your family, it's always good just to keep some of these tips in mind. Your physical environment can have a lot of influence on the safety and fall prevention. So have bright lighting, clear the floors of clutter, have handrails on your staircases, have equipment where it could help you with raised seats, grab bars, things that will optimize your safety to avoid difficulties if you're having trouble. Having a telephone or medical alarm pendant within reach at all times is a
You're having so much fun up here. I just wanted to come up as well.
Okay, yes, join us. I'm not sure why.
Okay, thank you.
My slides, they need some training themselves.
No, yours.
Not cooperating. Okay, so we were looking at fall prevention tips. Our geriatric team in the Clinic for Healthy Aging, a part of our fall prevention approach is to look at different medications and how they might affect your balance and safety. So your geriatrician is a very important part of fall prevention. Similarly, occupational therapist and social worker. These are all a team that work together to help you be safe and function optimally. Also, our dietitian works with people to give you nutrition advice. All these components of health and safety are a really important part of the Clinic for Healthy Aging. So I just wanted to add that little tidbit in there. And if you do have concerns about falling or balance, always ask for assistance, especially when you come into St. Joe's, ask for help, and we can get things set up to make sure everything is optimally safe for you. Okay. So there are handouts with specific pictures and instructions on how to get up from a fall. So it's quite traumatic. It's quite jarring, of course. So if you happen to fall, it's very common and sometimes circumstances are beyond your control. So try not to panic. I know this is easier said than done, but don't try and jump up quickly because that can make you feel even more off balance and cause more trouble. If you're hurt, then use your medic alert or your telephone to get help. The first approach should be looking around your environment. Can you find something sturdy that you can use to get up with? So that is your first thought. If you have an injury or a problem in your left hip or your left shoulder, when you're going to get up, I would recommend rolling onto the stronger side. So go onto your right side because you'll use that bottom side to push up with your hip, push up with your arm. So start by using the strong side to get up, avoiding injuring a weakened side at all. So you're going to get your upper body raised off the ground, pause and steady yourself. Okay, getting to your hands and knees is the next step. Slowly, you've got your upper body up, now you've got your lower body up. Getting to that piece of furniture so you can use that support to get yourself upright. So the stronger knee or the knee that has more mobility, you want to slide that foot forward and raise your foot so that you have a lever to lift yourself up. Okay, with your other leg bent, you're going to use your arms to sort of lever yourself up. Both feet are on the ground, and then slowly turn yourself into the chair. So this is a method to get up if you have a piece of furniture, something sturdy to help you get up. This is some of the tasks that we will practice in physiotherapy if you come to work with me or when you come to the Clinic for Healthy Aging. And these are things that the components that we went through, these pictures here, specifically the one where you're laying on a chair and knees lower down, you can practice these activities, exercises. So that's in this traumatic one. Okay, so some review. Beginner exercises or the core of exercises, the foundation. You want to think about aerobic exercise, walking, and over time increasing the exertion with that scale. You're on a 6 on the scale of 0 to 10, where you're walking further, you're on a pedal bike, arm bike, treadmill, any activity that you feel like you're getting a nice challenge to your aerobics. Stretching, keeping mobile, keeping your range of motion full and ready to move. Strengthening, so the major muscle groups, you're going to use resistance exercises to challenge your muscles. Slightly increasing the load, gradual progressions. This is how we build strength. And then also balance exercises. So we're practicing with holding support, stand with narrow stance, standing on one leg, standing toe to heel. These are different exercises that will work on our balance. Okay, so after you have mastered this core sort of level of different types of activity, then you can progress from there. So walking more quickly, walking on inclined surfaces, walking with intervals. So that's where you might walk slowly and comfortably for 2 minutes, and then walk a little bit quicker for 1 minute and repeat that pattern. That's another great way to challenge your cardiovascular system. Balance activities and exercises. I practice these with the people I work with. So I have them stand on foam surfaces, uneven surfaces, practicing stepping over obstacles, practicing walking forwards, backwards in a line. These type of activities, if they're new to you, it's really helpful to work with a healthcare professional. So a physiotherapist, or sometimes there's specific balance exercise programs. And these are some things we'll tell you about shortly. Coordination, coordinating arm and leg exercises, and also another advanced type of exercise, do your resistance training while you're balancing. So these are all things to gradually work up to. And always remember, use your judgment when you're trying new activities and exercises, as you're the expert in you and how you experience these exercises. So just remember, everyone wants to hear instructions and guidance on what to do, but ultimately, if someone tells you to do something that doesn't seem right for you, then no thanks, and carry on and modify things. So always just be aware of your own safety. Okay. So in review, we have to take time and energy to stay ahead of these changes to function and mobility that might occur as we age. Make sure you plan some dedicated time to exercise. So investing most days of the week, and that minimum time amount was 150 minutes per week, equivalent to maybe 30 minutes 5 days a week. And that is your minimum. Just remember that. That's your baseline for exercise, and build up from there. But if we're starting from a place where you're not exercising as often, then start small. This is something to aim for. There's lots of goals we can make in terms of progression of your exercise endurance and activity. All right, so that challenge is needed to optimize benefit, thinking about your form, posture, technique. Your exercises will help prepare you for instances of unsteadiness, and hopefully to prevent falls. So, and always remember, sometimes things might get in the way of exercise time. Just don't give up. Start back up when you're ready. If you miss a day, start again the next day. It's always variable what happens from day to day. So just keep in mind these approaches to exercise, and hopefully this will get you on the road to getting a challenge for your daily exercise program. Okay, so in exercise, always remember you're not alone. There's a community around you. There's many facilities in the West End, quite near the hospital even, that offer a variety of programs and services. Walking groups, chair yoga, dance, badminton, and specifically there's a program, Strong and Steady, that addresses balance and function that would help continue on things that you might learn from your physiotherapist or learn from your healthcare professional about maintaining balance and safety. So as a part of the presentation, there's a guide that we've put together to just give you an idea of some of the programs available and places nearby that have excellent services available. So I'll highlight a couple of them that are in your handout. In particular, we have Stonegate Community Health Center. It's a community-focused healthcare center with some fitness programs. It is located only 3 kilometers from St. Joe's, so it's in our proximity, and a way to find a spot for exercise and community and interacting with other people. So that's one of our resources. And another, there's 2 locations for community care health. It's a community health agency. It promotes well-being across all ages, specialized options for older adults, and yoga, pole walking, and that program I mentioned, the Strong and Steady program. So there's a Bloor Street site and a Dundas Street site. So these are some ideas of the resources we have in our little handout for you to look over and consider for your exercise and activity. All right, so that concludes my formal presentation. So we can open it up to questions if you'd like, and I'm happy to answer as best I can to see what additional information I can offer today.
So we have a couple questions coming in online. Maybe I'll ask one to
Okay,
kick
sounds
us
good.
off. And then...
Certainly. Okay,
people in the room. So we have one viewer asking, what advice would you give to someone who's managing joint pain as they're starting to exercise?
Absolutely. That's a common trouble. So I might work with patients with joint pain in one-on-one physiotherapy. Thinking about your functional activities day to day. Speaking with your doctor about possible pain relief and finding out what the cause of the joint pain is helpful as a start. Keeping moving, keeping with your walking and activity can really promote, in some cases, depending on the cause of the joint pain, relief of pain. So gentle motion, sometimes depending on which joint, you want to maintain some weight bearing. So if your knees are sore, you do want to walk. You can also do exercises for the knee joints where they're not pressing through the ground, where you're lifting different light weights or working in a swimming pool, warm water, all ways of keeping the joint moving, because that is key. Sore joints are very common, but keep them moving with the guidance of maybe a healthcare professional, just to make sure you're following the right track.
Great, thank you. And maybe as a follow-up, you mentioned swimming. And we had
Yes.
another question come in, if you can recommend anywhere that has warm swimming pools.
Yes, there are a number of warm water therapy pools in right around St. Joe's and across the city. So maybe that'll be a resource list that we can also add to send out to everyone. That's a very good way to exercise the joints with less pressure through weight bearing.
Great. We have another person asking too, do you have recommendations? We've talked a lot about like physical.
Yes.
Do you have recommendations for maybe staying motivated, whether you're just starting out or maybe you've experienced a setback, and just how mentally staying motivated?
That is such an important consideration. Having the motivation and the interest and the enjoyment of your exercise and activity is so important. Part of it, I think the balance between optimizing your exercise so that you get results, you feel better, you feel stronger without overdoing it, without going too far that you feel quite uncomfortable for a few days. Getting to the point where you have that balance can be easier with guidance. An exercise class instructor, physiotherapist, kinesiologist, your geriatrician, your occupational therapist. These are the specialists that will help guide you. And when you do have setbacks, they're expected, they're quite common. As I mentioned before, always don't give up, continue on, slowly reduce the amount of exertion, reduce the amount of weight, just cut back a little bit, make your movement smaller. Then gradually you can work back into what you were doing before, but always make that a gradual transition. So there's no sudden increases in intensity that might bring you back to further setback. But that is to be expected, really. And you must carry on as best you can and seek guidance from healthcare professionals, because it's very difficult.
Great. Thank you. I saw a couple hands maybe go up in the room if we want to take some questions from.
Yeah, any questions from the room?
I have one. This has been really helpful so far. Thank you very much.
Oh, you're very welcome.
You mentioned nutrition briefly. And
Yes.
I wonder, as we age, whether our nutritional requirements are also subject to change and what we should be focusing on.
Absolutely. So we have an expert on our team here, Lauren. She's our dietitian for the Clinic for Healthy Aging. So speaking with the dietitian is the best route to getting all the essential information. But absolutely, eating and our health are very closely intertwined. So activity, diet, mental well-being, cognitive function, all the big picture of our geriatric team will work to help you with all these things. So that's a very important.
Do you need a referral to the dietitian?
I believe I will find that information out for you.
Thanks.
But we do have a dietitian and a part of our team, and there's also online resources that you can check. We will add those resources
Thank you very much.
to our handout for everyone. Another question?
Maybe I'll just add too, so we had a great presentation with Jacqueline and Lauren previously.
That's right.
And that's online, that we have a recording of the presentation,
great.
and sort of half of it was the sort of physicals, keeping fit, and another half was nutrition. So there's some great information in that slide deck that we can share.
Thank you.
Well, yeah.
That's a great idea.
Did anyone else have a question? Yeah.
Question here?
I have 6 things.
6.
Can I do 6
All right.
things and try to
Give me
make
the
it
first
quick?
one.
Yeah, no, that's right. I don't, okay, here, some make more sense than others. What's a healthcare professional? You say you're a physician or a healthcare, but what's the
Okay.
alternative to that? I don't have a physician at the moment. My
Oh,
sister's
goodness,
retired.
So healthcare professionals, they've undergone the training through the medical health system. So your family physician, your specialist, physiotherapist, occupational therapist, nurse, dietitian,
Walk-in clinic.
walk-in clinic,
Okay,
they have
that's the thing.
physicians. So speaking with someone who knows you and understands all your conditions is someone who can help give you a sort of precise guidance on how to best exercise.
They're hard to find now. I think that we're, okay, thank you. Now, okay, number 2, deep breathing. You can give me,
Yes.
show me an example. Give me an example. Show us how to deep breathe.
Certainly.
Oh, you have to stay over here and do it.
I don't know if I will demonstrate, but
All right.
it's working with a physiotherapist and thinking about the expansion of the lungs, thinking about the mechanics of the rib cage, expanding, opening up. It's a physical type pressure change. You're gonna pull all the air in you can with good posture so that the lungs will inflate fully. So thinking about just expanding the lungs, breathing in through the nose and out through the mouth. There's an
Okay, thank you.
example.
How do you get rid of what's in your, how do you empty your lungs?
So we never truly empty our lungs. There is a residual air volume within the lungs. If there's secretions in your lungs, then you can clear those. That might be another talk, another
Thank you.
time.
That's a subset of that question, so I'm up to 7 now. Okay.
So sorry if I just jump in for 1 second. We only have a couple more minutes.
That's right.
Okay.
And
I
there will
will
be
speak
time
with
to
you after.
chat with Jacqueline
Yes,
after
so we can
the
address further
presentation.
questions.
Okay.
Sorry, there's
Okay,
one more
one more
that
question.
came in the chat actually. Swimming seems to be very popular, and someone's asking if you can recommend specific aquafit programs.
Certainly, there's different types of aquafit programs. There's shallow end, where you don't have to necessarily know how to swim, and there's lifeguards, walking through the water, different resistance exercises. Different city community programs offer aquafit. Also, outside in Mississauga, I know they have programs, North York. In the GTA, there's a vast number of programs. So I mentioned shallow end aquafit. There's also a deep end aquafit where you might wear a flotation device and move through with the buoyancy of the waist support.
Great. We just had someone in sort of response to if there's warm therapeutic pools, someone
Yes.
recommended the Gus Ryder pool.
Yes.
At Kipling and Lakeshore.
Yep, that's a wonderful facility.
We probably have time for maybe one more question, if there's one question, and then we'll wrap up. Thank you.
Is a saltwater pool better for you than a freshwater pool?
So the saltwater pool, I'm not an expert in pool chemistry, but I do believe it might have less damaging effects on your skin. The chlorine can be very drying, but in terms of exercise and activity, both types of pools would be equally beneficial for exercise. Okay, thank you so much. We'll be up to Janine again.
Thank you, Jacqueline. I love your tips, especially the one about the posture, your ears, your shoulders and your knees. That's very good thing to remember, not only for our generation, but for our kids and grandkids. So thank you for that. And thank you all for spending your morning with us. If you have any questions, feedback, or suggestion for the next topic, or you would like to learn more about various legacy gift options and benefits they present to you and your loved ones and for St. Joe's, please feel free to reach out to me directly. I'd be delighted to connect with you at your convenience and answer any questions you might have. Our next virtual Aging with Insight will take place in September 3rd, with the head cardiologist, Dr. Anjali Anslem, and she will be discussing the cardiac health. Thank you again for joining us, and I will keep the Zoom open for a little bit more. And for those people who still want to ask questions, Jacqueline, and are in the room, please do so. Thank you.
No,
Yeah.
Okay.